Hello everybody, my name is Sofia Komisarova and I'm here today with Dr Ewout van Ginneken from the European Observatory of Health Systems and Policies and one of the speakers of this year's CARE Summit. Thank you so much for taking time to talk to us, and we would really like to hear your thoughts. And I know that the event just started, but maybe you can share some of your first impressions with us.
Yes, of course, I'm happy to. We had a full room of people already with very knowledgeable people, all the right people in the room, so I think that is very positive. And the message that I brought with me, and also one that we are discussing today, that spending on health is not a drag on the economy, it's an investment, it's not a cost. And what are the arguments to use there? And what I've been talking about is that, of course, we've been talking about health and all policies, that other sectors doing certain measures, think of, I don't know, preventing road traffic accidents or others, have an effect, a positive effect on health. But it's also vice versa, and that's what we call health for all policies, where measures you take in the health system have positive impact outside the health sector, which gives us extra ammunition with people who have to ultimately pay for healthcare and investment rather in healthcare, to use those with them to make the case for investing in health. Some are very obvious, and we discussed those today, that a healthier population will be more productive, higher educational attainment. Also, the fact that health is a stable sector of the economy worth investing in, stable jobs during recessions, that is something that is, of course, attractive as well. And there is also increasingly evidence that investing in health also leads to a better macroeconomic performance, so growth. And that's another argument you want to bring in. And one that is perhaps more surprising is that investing in health also leads healthier people to participate more in all kinds of public institutions and in civil society, which has a strong effect on stability and ultimately peace. And I think that is one that also leads to a more competitive system, because strong institutions is one of the pillars of the competitiveness index of the World Economic Forum, just to name one. Health is another, and skills are another. And health sector provides highly skilled labor. So also there are so many arguments that we can use. We just need to put them in the right order, I said in the panel, and also to the right people.
Thank you so much. That's very interesting, and I think it brings us very well to a next question of me, because the final goal of the CARE Summit is a co-creation of a roadmap for a stronger European Health Union. And maybe you can formulate some policy recommendations in a very simple and clear way that can be implemented, or maybe some key takeaways that we should definitely not miss when we are working on this roadmap.
I think an important element of the roadmap will have to be how we advocate, how we show, and how we gather the evidence for prevention. And that's always a difficult one to do, because investing in prevention and promotion will have a return of investment that is much later, if you can at all even measure it. Another complicating factor is that the evidence does not show that prevention per se will lead to cost savings. So what we need to make as an argument is that prevention and investing in prevention will lead to a healthier population, which is a more productive population, etc., but also one that needs less care, so that it could also help reduce the disease burden of the future. And the earlier you start, even early life interventions, I think, is something you need to look at here. And then that will give us, I think, important arguments to show, especially now, considering the labor shortages, that if you have a lower care demand, it will become much more manageable in the future, although it will still be a challenge. And it will also flatten the cost curve and spending on health. So I think it is an important element that will definitely need to be part of this roadmap, on top of all the things I've mentioned before about finding the right narrative, about all the co-benefits that good health has for other sectors of the economy.
Thank you so much. Thank you for your time and for your insights. We really appreciate your sharing your thoughts with us.
It's my pleasure. Thank you.